Hey guys, I know I haven't vlogged in a little bit, but it's been a very busy week. I started my new job, which is going great. It's from home. I'll explain to you further down the vlog, but I'm just currently right now sitting outside of the urgent care center. Yesterday I noticed that I had a quite large area, a little bit bigger than that, under my right breast, and it was leaking blood and fluid. And I'm usually very body aware just because of everything that I've been through. You tend to know like your signs, your symptoms, all that stuff, and I was kind of shocked because it's something, like, I just had a shower like the day before yesterday, and like I didn't notice it then, but it must have been there for a long time because it's sort of scabbed over, and then there's two smaller wounds like right beside it that are sort of leaking as well. And of course you go down the rabbit hole of what the F is this. And of course when I'm, Googling all that information, what comes up is breast cancer, and the photos from the breast cancer sites look exactly like the wounds that I have under my right breast. They're right, like under my nipple on my right breast. So yesterday I worked in the afternoon, so I had to finish my shift, and then I got up this morning and got ready to come. A walk-in clinic wouldn't take me. My family doctor can't see me for like weeks, and it's infected for sure, whatever it is. So I am just going to get it checked out now, but I thought that I would just kind of pop on here and hope that it's nothing, that it's just a rash or something, or I don't know what. And it's really weird because like the blood work that I had done on my infusion days, which was this just past week, everything, like the infection levels weren't anything. So yeah, I don't know, it's really weird, and I don't know what it is. So I definitely probably need antibiotics, because it is infected. The stuff that was coming out of it was definitely infection stuff. So I'm going to don my mask and come into the walk-in or the urgent care, and I have to say it's been a long time since I've had like an infection like this or something wrong. So it's a little bit scary. But hopefully it's nothing, and it's just like something that they can just give me antibiotics for and fix it. But I really don't know. I have this really weird feeling, so I will update you guys later. Thanks for watching, guys. Hey guys, it's just me. Obviously, you clicked on the video. Oh my gosh, I still have my face. Currently on my break at work, which is my house, which is still pretty darn cool. So I was seeing the last video I put together, I was in the parking lot of the urgent care clinic going in to get my wound checked. They were pretty quick. I was only there for about just under 2 hours, which is not bad, completely from the time I got there to the time I left. So the doctor looked at it, not sure what it is. He did give me a week's worth of antibiotics, really strong antibiotics, to see that if is indeed just a wound, to see if that will help. At the end of those 7 days, I'm to go back and get it checked again. And if it hasn't healed, then they're going to be able to either do the a biopsy there, or I'll have to schedule one. The antibiotics are making me so sick. I feel nauseous all the time. I hate antibiotics. This is like only the 3rd time that I've been on antibiotics since I was diagnosed with CVID, which means that it's doing its job because, you know, thinking 3-4 years back, I was literally in the hospital for about 3 months out of the year with infections and multiple different issues, as you guys have been, you know, watching if you've seen my earlier videos. I don't know what this could be if it doesn't heal with the antibiotics. It's actually currently getting worse. There's a lot of red swollen tissue around the wound. The wound is about probably that big, and then there's like a smaller wound right beside it, and then the beginning of a 3rd area that's starting to open, and it drains like grossness and blood. So I have to keep an eye on that, and if they continue to make me this sick, I don't know whether to go back and get a different antibiotic or if to just suck it up and take it and suffer for the week, and hopefully because of the strength and dose that I'm on, it will fix the problem. I don't know, guys. I don't know what it could be. I'm really hoping it's not cancer, but given my family history and the fact that I'm at a higher chance of getting cancer because of my CVID, I don't know. My great aunt had breast cancer. I mean, my dad passed away from pancreatic cancer. It's just, there's a lot, a big history on my dad's side. Everybody of some sort. My grandmother died from lung cancer with Mets. Yeah, so I am hopeful that it is just a random infection that I got. And it's so weird because, and I think I said this in my last video, but like when they did my infusions last week, they checked my levels and everything looked really good, so it didn't show in my blood work that there's an infection, which I don't know if CVID would change that or not, but I'm surprised that the blood work didn't show, because it's something that's obviously been there or brewing underneath the skin for some time. I don't know, so I have to keep it clean. I have to put gauze in my bra to soak up any drainage. Oh, there's the kitty there, and there's a kitty. Oh, there's the kitty there. And I can't wear an underwire bra right now, just cloth bras. And I should lay on my left side, not on my right side, and apply like warm compresses to it during the day to see if it will help drain and get rid of some of the infection that way. I don't know. I've been doing everything that they've told me to do, so I honestly thought that this part of my life was over, and yeah, so I'm going to continue to document what's going on, and I will fill you guys in when I know anything or if things start to look better or worse. I will update you. I still have my HelloFresh video to post, to complete and post. I really like HelloFresh. Yeah, so that's it for now, and I will log on when I know more things. Okay, bye. Okay, everyone, I am back in the hospital. Not what I thought would be happening right now again. I talked to Dr. on the phone yesterday, and he suggested to come to the ER to get that area checked because he wasn't 100% sure that the treatment that I got was appropriate. So I'm here. I'm just waiting for an ultrasound. They started me on IV antibiotics. Yeah, so I'm just waiting. My glasses are at home. I don't have them. No matter how long I vlog, when people walk into a room and I'm talking to a camera, I feel crazy. Like super crazy. Anyway, I look like shit hit the fan. Yeah, so I will add to the vlog when I can. It's been not fun at all. Hey everyone, I am home. I look like I've been run through a lawnmower. I'm so tired. So I don't quite recall what I recorded last, but they sent me down to, so at 11 o'clock this morning, they made an appointment at the breast assessment clinic within the hospital, and they were able to do the ultrasound of my breast. And they called the doctor in just to make sure that everything was, you know, proper, which initially, let me tell you, when she said I've got to go get the doctor, I was really scared. I'm so bloated right now. Oh my God. So he said that, you know, it looks like a really bad infection. And they want to do a mammogram, but they can't because if the machine squeezes that wound, chances are it's just gonna bust right open. And yeah, so I have to let the area heal, and then they're gonna do a mammogram. So guys, I thought it was cancer. I honestly thought it was cancer. Yeah, I feel lucky that it's not, or that even the possibility is very low. The mammogram is for, you know, follow-up purposes, just to check to see, you know, what the tissue looks like after it heals and whatnot. So yeah, I was given, you know, doses of IV antibiotics, which is really good because I know it's getting into my system. It's doing what it's supposed to do. They gave me a very large dose, which, of course, even though it's, you know, medicine and it's doing its job, it's making me so sick. So they gave me a prescription for Zofran as well. I'm just taking the antibiotics for another 7 days. And then if at the end of those 7 days, or even on like day 5 or 4, if I notice that there's not been enough healing, that they will arrange for home care to come in and do IV antibiotics for 7 days. So I'm really, really hoping that I fall into column 1, which is the medication works and everything is fine. Do I think that that's what's gonna happen? My past history says else, says otherwise. But I'm trying to be positive, and Mom took me to get my medication, and then we stopped, we stopped in Shoppers to get the meds done, do you know for 10 Zofran pills, so this is a medication that is widely used in the cancer care area. It's also used for people with migraines and stuff like that, but it literally is like the best anti-emetic medication, which is anti-nausea medication. It takes away all of the nausea. It takes away all of the, just kind of crappy old feelings. So she gave me those, for 10 pills, it was $70. Like, that's crazy. Like, and that's not covered by my current government plan. So I did have to pay for that out of pocket, which isn't bad. I mean, I've been very lucky in terms of even getting coverage from the government while I don't have benefits, because there's no way that I would be able to pay for everything. It's bad enough that 4 times a year I have to pay out of pocket, sometimes between $2,000 and $6,000, depending on what's going on, and that one hurts. Like, that hurts, but it is what it is. You gotta do what you gotta do. I don't have a benefit package, so I rely on Trillium, which I'm very, very grateful and feel blessed for. Anyways, doctor was so nice to me, and it's a hard time right now for healthcare workers, and things are different, and patterns are different, and jobs are different, and all that stuff. And even though all of that, she treated me with the greatest respect, the greatest dignity. She had been my physician in the ER a few times before when I was having, the chest related issues, like not the boob chest, like the heart chest related issues. And she's treated me a few times, and, she came into the little cubicle this morning and she just said, because it's you, we're going to do some blood work. Normally we wouldn't do blood work on somebody who's here just for an abscess, but because of the issues that I have, they did blood work. It showed a high level of infection in my blood, not in my blood, but from the blood work. She also called Dr. Sear, who is my immunologist, and he agreed with the treatment plan, specifically to add extra days onto the antibiotic, just to give it a chance. So I'm glad that they were able to connect. I also connected with Dr. On today. I just, let him know what was going on, because, he's the one that encouraged me to go to the ER. So I mean, today was all about tits out and everybody's seeing, and, you just don't care, because to them it's not a boob, right? It's a breast. It's a, an aspect of the woman's body that is unbelievable and can feed babies, and that is their purpose. And it's only, I would say, our society that sexualizes that, because I mean, look at all the countries where women don't wear tops and stuff like that, and it's very less sexualized, I think, in our area of the woods of the world. So yeah, so that's been my week, sort of. I was really disappointed that I got an infection, which is a weird word. But I have to come to the realization, and my mom and I were talking about this earlier, is that these little blips will be part of my life for my whole life, and I can do as much as I possibly can to prevent infection and to quarantine even when nobody else is, and to, follow all the rules and all the things that I was doing before COVID happened. I was wearing a mask. I wasn't socializing. I was very cautious, just in life. And I mean, back, you know, a year and a half ago, somebody wearing a mask all the time just wasn't normal. So everybody kind of got to join my journey of isolation and, you know, just trying to get by with, you know, yeah. So anyways, I am home at mom's. I'm gonna go to work tomorrow. I mean, I'm just working from home, so it's, I mean, I can take my breaks and relax and whatnot. And yeah, so I am very cautiously relieved. I still have a lot of healing to do. The infection is just making me feel overall not well, so I don't feel great, but I know that will pass as well. Follow up just to rule out any possibility at all of it being something more serious, and then I can relax a little bit. So yeah, it was a scary week, I have to tell you that, a very scary week. And man, just the thought of you know, the worst case scenario was hard, and having those conversations with the medical team today and all of that was hard. So I am wiped out both emotionally and physically right now, so I am just hydrating like crazy and, you know, eating popsicles and all that kind of stuff just to A, stop the nausea, and B, you know, try and just beat this and chalk it up to my crappy immune system and go on from there. So thank you guys for, you know, messaging me and all of that. I really, really appreciate it. So I know I haven't posted in a while, but I will post one soon about my new job that I got last week. So yeah, thanks guys. I appreciate it. Like I said, it's been a very hard, scary week. So here we are. Bye.